Very welcome to our session today. And those who are new colleagues today, this is my humble introduction. Myself, Dr. M. Osman Ghani, working as Associate Professor of Medicine. But personally, I'm very much inclined and feel pleasure to be a family physician. And today our topic will be, this is our institute, in short, and we will be talking today just to give you idea of making a checklist. Nowadays, the popular word checklist, because the all clinical exams are becoming not only clinical, rather to say the practical exam also. The OSCE, objective structured practical examination. This is also very dependent on the checklist. And as myself, some additional introduction, personally in my country, now I'm working as a trainer for the teachers in medical college. And we are busy to create many checklists for the OSCE or OSCE exams or practical clinical exams. So from all of my experiences, guide me to tell you some important information. I hope that it will be beneficial for you for OSCE exam especially. And later on, we will show you some scenarios of the OSCE exam for the MRCGP. First of all, I like to show you one picture shot from a book. It's a very popular book for the OSCE exam. If you find a patient actually is a baby accompanied by mother or a little advanced aged baby, the baby who can talk to you like that. Whatever, a patient presented with the diarrhea, a baby presented with the diarrhea. So what important points we need to know? I don't know, Dr. Hind, can you read the screen, doctor? Like before, if you don't mind, I will feel encouraged, doctor, if you can read it. Dr. Hind, number one, can you read? There are 3 headlines that for the diarrhea, we need to know some informations of the presenting illness. That means examiner, actually, the examinee asking the patient or not. The design is like that. The sentencing is designed in a manner. The examinee asked about the onset of the diarrhea. That means the surrogate giving the marks here, not rather to marks, rather given the checklist, the monitored by the surrogate self. So if the examinee asks the question, then surrogate, okay, 1 check mark. But your OSCE exam is actually observed by the examiner. It is not the surrogate. The examiner will have the checklist in their hand. Actually, today's intention is not the structure. Today's intention to create a checklist. Dr. Hind, can you read, doctor?
History of present illness.
Actually, this will not be your complete checklist. I'm just starting with someone. For example, I will tell a modified one for the OSCE in future. Don't worry. Dr. Hind, please read out one by one, please.
Ask about one set of the diarrhea.
Okay.
There is a start 2 days ago.
That was the answer by the surrogate. It started 2 days ago. Okay.
Ask about number of bowel movement per day.
Yes, it is important question.
Basics
Okay.
tail.
They are
Episode
giving
tail.
the answer. Within the bracket, this is the answer of the surrogate. Okay, then.
Ask about any blood in the stool.
Okay.
No.
That is the red
Ask
flag.
about,
That is the red
yes.
flag. You know already those who appeared exam in the OSCE or just appeared the AKT. You know the word red flag. That means in the data collection, red flag is very important. Okay, next, Dr. Hind.
Ask about any vomiting.
Okay, none. No vomiting there. Then.
Ask about any fever.
Yes.
None, and has taken his temperature every 4 hours.
Yes. Okay.
Ask about urine flow. Decrease in number of wet fever.
With diapers.
Very little urine. diaper.
Not. So it's very,
Very
very
little
important
urine.
red flag. Anuria or oliguria possibilities there due to the diarrhea. Okay.
Yes, patient dehydrated if
Yes, could be.
decrease number.
Yeah, more likely, more likely. And then,
Ask about any tear when crying.
yes.
Not tear.
Okay.
Ask about the child oral intake. Few ounce of or jaundice or
Juice, few ounces
juice
of juice
every
every 6 hours.
Yes.
Yeah.
Yes. Ask about any change in personality of the baby.
Yes,
Irritable, lethargic,
irritable, lethargic. That
very
means
sleepy.
general appearance. General
Yes.
appearance. Okay.
Yes. Ask about any past medical history.
That means
Diarrhea.
any diarrhea. Baby means could be type 1 diabetes more likely.
Yes.
Okay.
Ask about any contact of illness. None once
Contacts
at
are
home.
ill. Ask
Yes.
if any contacts are ill. That means in the home or outside, baby was in contact with any ill patient. So it's 11 point they have set the author for the history. And come to the physical examination here. Before going to physical examination, I like to add here, especially for the OSCE in the South Asian perspective, the diarrhea patient in a baby, usually you don't need to examine because the baby usually not produced in the station, in the exam. Okay. So main thing will be from the history, and usually you will be talking to mother. That means it will be a proxy case. Mother will be talking on behalf of the baby. So in future, in your practice session, I hope that you will come to know the details, how to proceed with, how to ask the question. So one thing you can understand, Dr. Hind and others, when you are asking some question related to identify the dehydration or not, is not it, Dr. Hind? Suppose you are asking about the tears. So no tear, you are looking to
Yes.
the baby's eyes also. This is one of the physical examination. Okay. And the
Yes.
appearance, you are asking mother that how your baby is looking, or in general condition, is your baby irritable, is your baby sleepy, drowsy? Baby is not with the mother now. In real exam for you, especially OSCE, that baby at home, mother is talking. That means from the
Yeah.
history, you are getting some findings rather. Findings means clinical examination finding. Do you get the point, Dr. Hind? Especially in the proxy station, you need to ask some questions. Actually, the question identify the signs. That means that they had features of the
Like,
dehydration. You are asking in the history. Actually, you are getting some findings of the clinical examination also, like the
yes.
tears, then the irritable
Feel
appearance.
napping during.
Yes, and the urine is not the finding. Urine is just question. Urine output, you will ask the mother. Now, if you come to the physical examination area, you can see now, doctor. Please proceed, Dr. Hind.
What is the child using a scale in the examination room?
Weight the child. That means examining.
Wait,
That means candidate measure the weight of the body, weight of the baby. So weighed the child using the scale in examination room. That means there was a weighing machine.
yes.
Okay, then
Examine the skin for thinning.
tenting.
Thinning positive.
It is called tenting, doctor. You already know
Tenting.
that luster. You talked, doctor, in the last few days. Lusterless skin, right? Features of
Yes. Yes.
dehydration in the recall session. Can you remember?
Yes. Yes.
Lusterless
The
skin.
figure. Yes.
That is the examination, tenting test or tenting of the skin. Okay,
Yes.
then
Target.
targer, lusterless or
Yes.
targer. Yes, yes. You use the word
Yes.
targer. I can remember. The next one.
Yes. Check the capillary refill.
Yes,
Greater
is the
than
features of
3
peripheral circulatory failure.
Yes.
Peripheral circulatory failure. Okay, then
Look in the side. Look inside the mouth to check for dry mucous membrane.
tongue,
Mucous
especially
membrane are
dry
dry.
tongue. Dry tongue. Okay. Then
Check, check anterior fontanelle for depression.
So is a
Fontanelle
very,
or
very younger baby,
strength.
Fontanelli will be depressed.
Yes, severe dehydration. Check
Yes.
the neck for rigidity. No
Rigidity,
rigidity.
no rigidity. Okay.
Um, Press gently on the abdomen.
That
No
means any
tenderness
tenderness
and no
or
mass.
okay. So
Mm,
this is the total 18 points. 18 points. And I'm happy that you could read out, doctor. Otherwise, I actually made some slide for you. But as it is readable and in a one page for that, I open it. If suppose that slide actually prepared before going that, this is a scenario. Anyway, I am going back. I will go step by step. So here, 18 points they set in their exam. But even you have attended AKT exam and other also, when you have got the question, or those who appeared the OSCE before also, or you appeared any orientation courses, this is not enough. Okay. Suppose you know that when we talk about a baby, we need to know some features for any baby patient. What was the mnemonic? There is the binds. And sometimes we say the P binds, including the pregnancy status also. So here, no question about any immunization. No question about the nutrition, previous condition about. No information about the development. That means the social development, motor or sensory milestones. But in future, in the OSCE preparation, you must do it. I will show you later. In the physical examination, we divide the examination into two parts, the general physical examination and a specific physical examination. But here, patient, the baby having the diarrhea, so it is a GI tract. In the point from 12 up to 18, you will find that the local examination means, suppose, the tenderness of the abdomen. Otherwise, all the things, if you see the tenting of the skin in the abdomen, you can include in the abdominal examination. Only 2. So remaining 6 actually part of the general examination. What do you think, Dr. Hind? It's not abdominal
General
examination
examination or
altogether.
specific?
Or non-specific, whatever you say. Non-specific means general examination. Okay, doctor? Specific means is the local examination. So if you target the abdomen as the patient have diarrhea, so you got only 2 examination important in the abdomen. That means in the examination part, we need to separate the general examination points and the local or
Specific.
systemic examination or specific, whatever you say. Then there are some other issues also. Social issue, financial status. I will show you later. That means what I need to say you that this is one of the type of OSCE checklist, actually not 100% fit for the MRCGP OSCE examination. Okay, doctor? I think those who appeared, who attended our classes before, you understood it. So you should not be biased by any book. You need to have orientation for OSCE preparation. In the last paragraph is actually the communication skill, and a lot of things you will come to know. So today's topic actually be busy with the clinical presentation, the symptoms and the sign issues. Suppose during the history, what we need to know about, this is a chart designed to make a universal data sheet for the history taking. And not only for the OSCE, it cover our PACES exam as well. And we are discussing the script with the PACES candidate, those who are getting the training from us. So this is only history. Okay. These steps are there. Many often you have seen, some of you might be in previous sessions or in our YouTube or our open session before. And you know, the headlines of the history taking. If you remember the previous history points, I am now giving you in a big size, font size, the same thing what Dr. Hind read out. The points are there. Suppose this is the red flag, fever, vomiting, blood. And this is the diarrhea frequency. Ask about any tears. This is associated other symptoms, tears. Okay, patient presented with the diarrhea, but you are asking about the tears. So tears is a separate symptom in the eyes, changes in the personality. Now asking about the past medical history, if any contact is a social history. So actually you are covering some points from the history. Those are very, very relevant. If I go back again, suppose in the history sheet, a lot of headlines are there. But during creating a checklist, I must know from the history which point is very important. Suppose the family history for the baby. Suppose the baby presented with diarrhea just 2 days, and previously baby was very okay without any other problem. Do you think that the family history of the illness is very important here? What do you think, Dr. Hind? If Dr. Hind, you can talk. You already got the points. Do you think that the family history is very important for a diarrhea patient, acute diarrhea 2 days? Anybody can respond, doctor, if Dr. Hind is busy. My
No,
beloved
doctor, I
colleague.
think it's not necessary.
Yes, thank you, Dr. Taiba. So it's not necessary. In this way, you will remove the points from there, from the history sheet. According to the symptom, you prepare your checklist. So checklist is not hard and fast. The station inside the OSCE exam can guide you to modify the checklist also. And practically you can do it. You can do it. Okay. But there are some points for the OSCE exam, especially eyes, idea, concern, expectation. It is a must. So we will ask the mother, especially the diarrhea patient, that what you are thinking about the illness of your baby, what causing it. This is the idea. So you will get a detailed discussion of the detailed history, tracking and others in the YouTube. So I am jumping to the next one. We discussed this in the history. The points are there as just to show you in a bigger font size. Second one, there's examination finding already discussed or volunteered by Dr. Hind for the diarrhea patient. And lastly, the communication, actually, I don't like to discuss now. You will talk to
Sir,
the
can I
patient
ask
by
one
management.
question?
Why not, please, please.
Sir, where do we check the capillary refill? What is the exact site to check the capillary refill?
Nail bed, doctor. You just press the nail.
Okay, okay. And then one thing more, sir. The ice. Do we have to ask it in every counseling session? The ice. The ideas concern.
Almost. Most of the station you need to ask about the ice.
All right, sir. And one thing more.
Especially patient presented with the symptom or sign or any investigation data.
Okay, all right.
But there are some special station like the breaking bad news, angry patient. These are extraordinary. Those stations don't need to know about the eyes. Especially any diagnostic station, we must ask about the eyes. But the surrogates are tricky. They told you before the eyes, but you couldn't have the click in your mind. But you are asking you're the same thing. It depends upon your skill that will you ask this thing or not. So in the case practice session, you will get these tactics, no problem. Okay, any further?
Yes, sir. One thing more in this physical examination, don't we check the eyes for tears?
Eyes for tears. Yeah, definitely.
Yes.
Definitely. As you asked in the history, for that you are not asking. You are not checking. But I like to add again, I told before, possibly you couldn't give more attention. In the South Asian pattern, international OSCE pattern, especially for the baby, till now, the organizing of the pediatric station is baby will not be there. You will be talking only to the mother. Dr. Taiba, why you become connected? Be
no,
connected,
sir, I'm there.
doctor. Don't
yes,
go down.
Sir,
I am
no,
searching
sir,
you. So actually, these are the information I'm sharing already. That one design of the OSCE I have shown. I'm just jumping towards our checklist. Swiftly, don't be busy with this. I'm just showing, for example. And I discussed these in the examination part. In the examination, suppose your patient is not baby, adult gentleman, patient presented with abdominal pain or the fever. Definitely, the examination part will be some points from the general examination, some points from the systemic or local examination. It depends upon the symptoms presented with. So that is the communication skill. This is very important for all stations. In the management part, your diagnosis. Suppose for the diarrhea, patient is dehydrated. So dehydrated means hospital admission is important. When you are talking with empathy, sympathy, not hurting, there are some qualities of communication or consultation. And already these are many, many available. We have also created the 23 points or 23 qualities of the consultation skill. This is actually given by the Royal College. Personally, myself, I was working with this. Even yesterday also in my country, in our own native language, I had a session 1 hour of that. If I'm sorry that those who are not from my country colleagues here today, you will not understand the language, but you will get it in another form in the YouTube also. Anyway, so the communication qualities you are utilizing here, but I am still not busy here, and I will jump there for our today's main topic. These are the management points. Actually, the 7 points I have collected from the 23 in the making a management plan, making a therapeutic plan. These are the 7 points. That means you will not make this thing or write in your the checklist. These are very prototype, very standard. So you don't need to write it. You don't need to write it in the checklist. I will show you. You will see. So in general, in the consultation planning, our target is the data gathering. Why should we gather data? We need to create the probable diagnosis and thinking of the differential diagnosis. What is the etiology of the disease and what the complication and comorbidities. In this data gathering, think that is a very family medicine special. What is the biologic issue? What is the psychological issue? What is the social issue? When you ask about the financial status, it will be social issue. When you ask about the mental condition, like how do you feel today, you are asking about the psychological issue. And the biology means your diagnosis, clinical diagnosis. So this is a big area, psychological points as well as social points. And other routine questions. There are some other routine questions I will show you. It is directly or indirectly related with the presentation. Routine question should be there. Suppose I told you before for the pediatric patient, P binds, 5 question is must. So these are the routine question for a baby, for all baby patient. Likely the geriatric also I will tell you. Even some smoking, especially the promotive health point of view, asking about the smoking, asking about the drinking. And South Asian zone in the, I think more countries, you know, those who are from Pakistan, Bangladesh, India, the people are chewing the tobacco. They are not smoking cigarette, but they're chewing the tobacco. My colleague can tell now, I hope. Those who are from the maybe the Middle East or Gulf, you don't have maybe this culture. What do you think, Doctor? I think who will ask? Dr. Modi is here. He's from India. And Dr. Fauzia from Pakistan. I think you have the experience, Doctor, the betel leaf, betel nut, and the tobacco leaf. What do you think?
Yes,
Yes,
sir.
Yes,
sir.
yes.
Very
Thank you
common.
for your response. Yes, but we are ignoring it. It will be very excellent. Asking rather, people are chewing the tobacco leaf, they are drinking less. Alcohol is a very Western culture. So intentionally, I added this for the South Asian perspective. So this could be a routine question. Finally, we will make a problem list and the management plan I have shown you. So this is the basic headlines. And coming to the list now, we discussed before, it could be repetition for you, and the repetition is good for memorization and understanding. Suppose those are new. Again, Dr. Hind and others, may I request someone else, those who appeared the AKT exam yesterday and now free, anyone please? Just to read, it will be more useful for you. Anyone, colleague, other than Dr. Hind? Just appeared the AKT and planning for the OSCE future. Nobody? So anyway, let me say, and I hope Dr. Hind will be happy to be with me also. So HS means actually history. I mean, in the data gathering part, you take the history accordingly, the chart I have shown you before, and you make the checklist from points, not all the informations. And the clinical examination by general and the what I say, the systemic or the local examination. Interesting thing is that like the PACES exam, usually doctor gets some minutes before entering the station, and the examiners provide a paper and the pen. You can write the planning by yourself before entering the station. But in the OSCE exam, you have only 1 minute outside. So you cannot read, you cannot write on any paper. You should have in your mind within 1 minute, just a thought process will work. What will be my checklist now? So it is very risky if you create the checklist very newly there. That means before going to appear the exam, beforehand, your preparation will include to create a checklist by yourself earlier. According to the instruction in the exam hall, you will modify a little according to the need. So this is one of the standard checklists we designed for every purpose, but definitely it can be modified. Definitely it can be modified. So history examination, then our target is to create the diagnostic formulations, the probable diagnosis, differential diagnosis in our mind. Minimum, there should be 3 dimensions of diagnosis. It is called triple diagnosis. It's a very recognized word in the family medicine. Triple diagnosis. 3 information should be there. Suppose if you diagnose only diabetes is not enough. That means you are not telling, you should have in your mind that when you collect the data, that biologic problem is the diabetes, but the psychologically patient is depressed or not. We should know, and as well as the financially sound or not. So Mr. Karim is a diabetic patient who is poor and he is feeling low. It will be a complete diagnosis. I think all of you got the point. After this, you are going to make investigation plan. Again, investigation, it will be in the MRCGP OSCE exam, better to be focused investigation, not routine. Routine means suppose you are dealing a patient of diabetes. So diabetes will include many investigations. But you are seeing a patient of chest pain, you are suspecting the ischemic heart disease, maybe acute coronary syndrome. So you don't need to do more investigation. Your plan is to shift the patient to the coronary care unit. But to be confident regarding your diagnosis, as a GP, you are not a specialist, remember. As a GP, you don't have all the facilities in your hand to do emergently. You can do minimum 1 ECG investigation. So only 1 ECG is enough for suspecting acute coronary syndrome. Or at best, you can do, to see the background, you have the capillary blood sugar machine. You can check the immediately capillary blood glucose. But if you think that I will do troponin I, but you are not working along with, beside with the hospital setup or laboratory, how can you get? So the Oxford Handbook of Clinical Practice, most of you are going through, I know. Then you will see there how much you can do in your chamber. So don't think that you are a specialist, though you are working in a specialist center. I know some of you, but you need to control yourself for the investigation plan. So this will be another point in your checklist should be there. And other routine question as much as possible. I have shown you drug allergy vaccination for the female patient, period, pill, and pregnancy status. That is the 3P we try to remember in this mnemonic. Period means the cycle, the lady getting the contraceptive pill. And what about the last menstrual period to exclude the pregnancy? And for the child patient, P bind, already I told you, the P means pregnancy status of the mother. B is the birth history during the delivery. Was there any problem? I is the immunization. N is the nutritional status. And the D is the development. That is the growth, physical and the mental growth. For the elderly, 3ID. I think, can anybody say 3ID? Please be interactive a little. 3ID means, how can say? Why not Dr. Hind and Dr. Yeah, please. Incontinence, then? Yeah, Dr. Suhaiba, please, you can say, continue, please. Incontinence. 3I, first complete the 3I, doctor. Yeah, 3I, doctor. Incontinence, instability, immobility.
Instability,
immobility. And the D means dementia. This is the memory problem.
dementia.
So these should be the routine question. But if patient is not pediatric, why not, please?
Sir, what is the difference between instability and immobility?
Immobility actually like rigidity, slowness. Instability means fall.
Okay, sir. Okay.
Okay. Yeah. So this is a routine question you should know. Now you created the problem list already according to the biologic, psychologic, and the social issues. Then you will give a management plan according to the
Sir, can
problem
you
list.
just give an example like how to make a diagnosis with biopsychosocial model? How do we
Uh,
say the like if our diagnosis is diabetes, as you were saying previously, then
I
how
will
to?
give you some scenario, doctor. Hope I can explain there. I'm
Okay,
just
sir.
reading now the basic format for you. Huh? I will
All
show you
right.
some scenario of the exam. Anyway, so the regarding the management, so you see the problem list, how we are creating the problem list. Number one, definitive diagnosis. In the diagnosis, it include the etiology, complication, comorbidity. From there, some may be red flags, some the idea, concern, expectation. That means we are getting the data, asking by idea, that idea, how to ask idea. This is one of the skill, concern and expectation. And we are asking the impact in life, hidden agenda, ethical issue, legal issue. So in the problem list, we need to know it. Is there any hidden agenda? The red colors means these are very important. These are very, very important for MRCGP or OSCE exam. Finally, in the management, according to the problem list, you are explaining the diagnosis. If patient need referral, you will refer, especially acute patient must be referred. Emergency patient must be referred. Hospitalization referred. But few patient, just to make an OPD follow-up. In the OPD follow-up, we must say about the safety netting. Possibly some of you know what is safety netting. Most of you know that before the follow-up date, if patient have any trouble, what patient will do? I will explain to the patient. This is called safety netting. In the medication part, is not much important for the family medicine. More important is non-pharmacologic advice. Medication need means emergency medication you will give and some little medication. Don't be busy with the detailed medication. The specialist will give more medication. So more point is the non-pharmacologic treatment. That means the lifestyle, protection from the injury and others. Additionally, driving, flying. Sometime in the history, it is mentioned that the patient is a driver. But some diagnosis needs to know about the patient is driving or not. For example, a patient you are diagnosing is epilepsy, and all of you understand that we must know about the driving profession or not. Some patients have respiratory illness, COPD, breathlessness. So is patient having any planning to go by airlines? We must ask. Again, it is not very mandatory for all patients. But if our diagnosis suggests that I must know it, I must ask it. Driving and the flying, especially driving, is very, very important. And finally, the opportunistic health promotion. Health promotion always smoking, alcohol. I told you added that the betel nut chewing or any other bad habits. But opportunistic means maybe cigarette smoking is not related to the presentation, but I must talk about the cigarette smoking as a health point of view, prevention point of view. It is called opportunistic health promotion. So in this way, the checklist could be finished. So it is very, very compact one. That means we need to expand our horizon of the thinking or thought process for this. If I jump now and add the things already I mentioned, this will be a complete checklist for you, including these mnemonics. I hope that you can make a snapshot from here also for your future reference. And my suggestion, doctor, my humble suggestion that those who rely upon me, remember it. We always discuss it in our OSCE session. We always discuss it. And we actually customize something. And some of you know that the P, the pregnancy status, we intentionally added. In some books, the authors are writing only bind. It's very traditional. But in our understanding, we thought that for the baby's illness, pregnancy status of the mother also important. And you will agree with me also. For that, we just added one P. And these 3 IDs solely from our side, we did to remember it. This mnemonic is very useful. Whenever you get elderly patient, you need to ask these 4 questions. Okay, it is called the holistic approach. Now, I will show you the sub cases, general clinical case management with one example. This is a case. So I'm happy that Dr. Taiba was very interested to know about the diagnosis and others. May I ask Dr. Taiba to read the instruction, please?
All right, sir.
Please.
Reference Mr. John De Silva, age 50. Mr. Silva is complaining.
Can you
of leg
improve
pain.
your voice, Dr. Taiba? Can you check your sound system?
Okay, sir.
Please, can you repeat? Reference means this is the patient you are
Okay,
talking about.
Sir, I'm audible, right? Am I audible now?
Better. Thank you, doctor.
Okay. Mr. John De Silva, age 50 years. He is complaining of leg pain for the last 2 months. His blood pressure is 140/85. Pulse is 78 beats per minute. Temperature is 37 degree Fahrenheit. Respiratory rate is 16.
Cycle per minute.
Cycle per minute. Proceed with consultation. Perform relevant clinical examination and make a management plan.
This is very, very prototype, very standard, a clinical case management station. Most of the case like that, so with some additional issues. So if it is the thing, suppose all of you please think by yourself. You might be thinking some diagnosis. Those who know the case already you got the diagnosis, but who don't know, you are thinking what may be the cause of the leg pain. So always we consider the gender of the patient and the age of the patient. So it's a middle age at around 50 years. Complaining of the leg pain. If I ask Dr. Taiba, please, can you be connected as you are the volunteer here?
Yes, sir, I'm there.
Suppose leg pain for 2 months. It is not acute leg pain, it's a chronic leg pain. What might be the possibilities?
Sir, it could be radicular, lumbar sacral radiculopathy.
Radiculopathy, you are meaning that whole limb will have the pain and is a radiating pain. Possibly patient will have back pain
Back
also.
pain radiating to the leg, yes, sir.
Yes, so it means we need to ask about the back pain. In
Yes,
the information, back pain is not given. Back pain not mentioned. Patient telling you the leg pain, but for your diagnostic purpose, you are asking about the back pain. So how to ask it? This is another style. That do you have any other problem? Do you have any other problem? Then patient will tell you that, doctor, I have the back pain also. This is the symptomatology you are gathering now. The second point.
So can't we ask like this directly that do you have any, is it the leg pain itself or is it radiating from the back? Or
Oh, you will ask, but open means, sorry, doctor. If ask about the radiating, it is not the open question. You are asking the closed question.
Yes, sir.
It is an open question.
What would be the better way
better
of
question will be the more open question. More means not 5, 10, only 2 times minimum. Do you have any other problem? The second open question. Suppose first question is, how can I help you? The patient will tell you this thing. Second question, do you have any other problem for any symptom? Then patient will tell you some symptom may be related with the diagnosis. Some symptom may be related with the etiology. Some symptom may be related with the complication. Some symptom may be related with comorbidity. If you don't ask the open question, surrogate will not tell you. So you are missing many things. You are missing etiology. You might be missing comorbidity. You might be missing complication. But that second question is very important. Anyway, now in the leg pain, you are telling that only one, that radiating pain, lumbago sciatica, so-called, right, doctor? Radicular pain.
Yes, yes.
Other than this, what could be the possibility?
Peripheral arterial disease.
So peripheral arterial disease. Could it be peripheral venous disease?
Sir, but peripheral venous disease.
I am just telling in your voice, same voice. What is not peripheral venous disease though? As you are saying the peripheral arterial disease, could it be peripheral venous disease? Leg pain? Yes. Yes, why not? It could be deep venous thrombosis.
Sir, for 2 months?
Yes.
Deep vein
Yes.
thrombosis also
DVT.
presented with the leg pain. So it could be the arterial problem, it could be the venous problem.
Venous problem. Yes.
Venous problem. Now, to differentiate it, there are many points. I will not discuss it here detail. Is there any importance of asking the one leg pain or both leg pain? Can anybody say?
Yes, sir.
Dr.
Definitely
Shoaib?
we have to ask. Should ask.
Yes.
Which leg it is?
Yes.
Is it lateral or
Suppose
bilateral?
usually DVT can happen usually in the one leg, or even the peripheral arterial disease also most likely initially maybe probably and the first and the one right or left. But any generalized pain issue, suppose a rheumatologic disease or myopathy or other myositis rheumatologic disease, the both leg will have the pain. Radicular pain may be unilateral, maybe bilateral also. So in the data gathering, according to our suspicion, we need to go for the symptom analysis. And in the history chart I have shown you, you will get it later also if you want. We can provide, and you already have some of you, I know, that there is one mnemonic. It is called the OPD CATS. OPD CATS. For the pain, 1 point additional is the radiation. So these points we need to know for each symptom. From the leg pain, you got it. And for the leg pain, for the etiology, as you said that back pain, you asked about any lumbago sciatica. If any vascular disease, definitely you will ask about the diabetes. Definitely you will ask about the hypertension. Definitely you will ask about the hypercholesterolemia. In the social or personal history, you will ask about the smoking. Is not it? That means your checklist for this case should include those informations. Dr. Taiba, something clear
Yes,
to you
sir.
now?
Yes, sir.
Okay. In the examination part, what you will do?
So in this consultation means the word consultation means we have to take the history.
Yes, mainly in the MRCGP exam, consultation means talking to the patient.
Okay.
This is your task. The last sentence is your task. It is very important. If you don't understand your task, your performance will be bad. In some station, it is written that examination not needed. Even then you are going for examination. So it indicates you are inattentive doctor. Okay. Suppose in
So
the
how
leg
much
pain,
time
busy
is
with
given
this.
for
Doctor,
this? How much?
sorry, the miscellaneous thing we will discuss a little. Let her be busy with this point, leg pain. In the examination part, definitely you will check the leg, temperature, the muscle bulk, okay, hair distribution, including pulse, peripheral pulses, okay. And if it is you think that the radicular pain is there, you will possibly do the straight leg raising test, whatever you are thinking. So from the history, you will be able to make a narrow diagnosis that, okay, it is a peripheral arterial disease or is a venous disease or a neurologic disease, the radicular pain. Accordingly, you will design the local examination of the leg. But what about the general examination? Can anybody say in the leg pain issue, suppose your diagnosis is the peripheral arterial disease. You are thinking. In that case, what general examination is important? With a reason, please, anyone can say. Dr. Yaqub is here.
Yes.
Muhammad Yaqub Khan, please.
Vital signs and
Please.
heart examination.
Vitals already given, doctor. 140
And
over
heart.
85. So what is given, we will not repeat it. The vitals are given. In addition, what is important in a peripheral vascular disease issue?
Sir,
Xanthelismas, xanthomas or xanthelismas?
Sir,
Xanthal asthma, one by one. Okay, xanthal asthma indicate that underlying could be hyperlipidemia, right? Then
actually, sir,
is showing that patient is a
actually,
smoker.
actually, this is sir.
Let's hear from Dr. Fauzia, please. Okay, doctor. Wait. First, Dr. Fauzia, what you like to say?
Yes, sir, I'm saying that clubbing is important, that patient is a smoker, may have COPD, and the same smoking has caused his problem in his arteries, peripheral arterial disease. So it's important.
For the examination, doctor, for the cigarette smoker, what sign you are getting?
Clubbing, I'm saying clubbing.
Clubbing actually not the effect of the smoking. Clubbing may be associated with the malignancy, not COPD, remember. So clubbing is not important. Rather, for the ischemic episode anywhere in the body, why not anemia number 1? Okay.
Sir,
Yes,
actually, this
anemia.
is the case of peripheral vascular disease.
Okay.
So we will rule out in general examination all these examination which related to vessels. For
Very
example,
right. Very
yes,
right.
sir.
Very right. Very right. Suppose you will auscultate the carotid artery. Definitely.
Yes, sir.
So is
Yes.
you will be very enthusiastic, doctor. I understand. But thing is that for the OSCE station, you have to manage your time also. It is not very extensive analysis case. You are not a specialist, remember. You are family physician. You need to control your desire also. Because patient presented with the leg pain, you need to focus more in the leg pain. Only leg pain issue, you have some relative findings like the anemia number 1. In the blood pressure already given. If not given, you will measure the blood pressure. But if you go to the carotid and other, this is good if you have time. But in practical situation, you may not have enough time to see, to do everything. Even you need to do the fundoscopy also. Is not it, doctor, what you said before? Fundoscopy. Is there any hypertensive change in the retina? But it is not relevant for OSCE in the MRCGP. You will approach if you have time, but you don't need to do it. For that, we need orientation, that with which station, how much I will do. That is our target, that in our checklist, what should be included. So one example, we are discussing about the suspected peripheral arterial disease. What could be the point there? Just I am afraid to say that, doctor, if you search some books, like today I started with one, you may get 24 points, 26 points. But if you don't do according to the checklist we have shown from our side, so your performance will not be completed one. They have given in their style what I have shown for the diarrhea patient. But we need to do a holistic approach. This is South Asian or even the MRCGP UK also. We need to check it. So the examination and history we have done. And now you see in the according to the checklist we finished. What we did not discuss here for this patient. Can I come to Dr. Yaqub Khan, please? What you are talking about? What we did not discuss from this chart. Just tell one by one.
Sir, I just now joined.
You just now joined? Okay. Sorry.
No, I just now joined.
Okay. But anyway, Dr. Hind also. Anyone? For the peripheral arterial disease, we reached a diagnosis of peripheral arterial disease by history, by examination, comorbidities. But something we didn't ask from the patient according to this list in the right side. What are those?
Okay.
The social status and the psychosocial status.
Psychosocial means you say the point from here in this box. That means what is the occupation of the person, right?
Yes.
How much he is earning.
Yes, sir.
We didn't ask. Then,
sir, his mood,
if you say,
status.
doctor, if you say one by one, we didn't ask about the investigation plan. That means I didn't discuss with the patient already in our discussion that what will be the investigation. Investigation again will be a focus investigation, not detail too much. Especially suppose for the identification of the vascular issue, we can do one duplex study like the DVT, venous or arterial disease. But you don't have the facilities as a GP. You will refer somewhere for this arterial. Okay. But clinical examination you have done, and to identify the documented vascular disease, you know that ankle brachial pressure index. It could be a general, the clinical examination though, but you can send to some center those who are doing by the Doppler. ABPI, ankle brachial pressure index. In the examination, we didn't discuss. That is today we discuss something what we missed. Everywhere you will miss somewhere for any cases. For that, I am discussing, for example, suppose Dr. Taiba, why are you not telling the drug allergy? We didn't talk. We didn't talk about the vaccination. We didn't talk about elderly patients. Suppose 50 years, not much elderly. So we can ignore it also, the 3ID. The red flags, doctor. What red flags actually important here? I think Dr. Yaqub Khan can tell. You have extended observation also. What red flag information I didn't ask, we didn't discuss. For the leg pain
Sir,
patient,
in red flag, we will see that is there any ulcer? Is there any severe pain? Is there any
this is in the leg.
cyanosis in
This is in
the
the leg. Outside the leg, any red flag could be there by asking. Patient is
sir, any
smoker.
chest pain?
Yes,
chest pain?
fantastic, fantastic. Any chest pain of ischemic nature. So it could
Yes.
be the red flag.
Any
And
stroke? Any
stroke, okay, history of a stroke maybe. Apparently, maybe patient doesn't have anything, any other previous diagnosis, only the
Any pain
leg
in the
pain,
abdomen? Ischemic
colitis. But
yes,
thing
sir,
is that,
colitis.
but thing is that, if you want to ask one by one, many 10 red flags are there, but time is short.
Yes.
Time is short. So which is very life endangering one, that patient can die within hours. This is the chest pain. So minimum, I will ask the chest pain. But one thing fantastically you have done from the very beginning, what is that? Do you have any other problem? It can give you some safety that you ask one question by open question. Patient didn't tell you what you can do. If you want to do one by one by the focused or closed manner, the question will not be finished and time will not help you. For that, red flag maybe one or two. Then idea concern important. What patient is thinking of the cause of the leg pain, that impact in life. Suppose the patient is a marketing person, selling the material in the market, moving, he cannot walk. So it is impacting his life. This is important. Hidden agenda. Is there any personal life issue? Suppose in the peripheral arterial disease, patient might have libidinal problem or erectile dysfunction also. You see, this is a 50 years old male. So this is the way, there is a courtesy how to ask about the personal questions. So this is the hidden agenda could be there. In this case, must be a hidden agenda. In any other symptom, you have to create your hidden agenda issue by yourself. When you think of a checklist, then ethical issue, legal issue, if any, they are job related issue. Okay, might be. And the management plan, in the management plan, safety netting other we discussed. Driving, flying is not too much important. Okay, non-pharmacologic important, that exercise, not only medicine. As a GP, what medicine I can give for the leg pain patient? Dr. Jacob, can you tell? Suppose your diagnosis is peripheral arterial disease. Can you give?
Sir, I would like to suggest to start with graduated exercises under regular observation, and
right.
do the exercises until the pain starts. Then stop for a while, and then again start after some time.
Fantastic. And medicine?
Medicine, sir, actually we will give just only aspirin and refer for the specialist for cilostazil and Rifodref.
Actually,
I forgot the name.
We will not mention
Yeah.
the name of the medicine, that what a specialist will give. If I say that I am in a position of family physician, I am in a position of general practitioners, but I am telling that specialist will give you this thing. So I become a specialist now. Clear?
Fine, sir. Fine.
So what I will say is a communication quality, that, okay, I am giving you aspirin, okay, and I am sending to the specialist. The specialist can give you some additional medication. In that way, I can say.
Okay.
But not that a specialist will give it. Then patient will tell you, doctor, if a specialist will give it, why not you are giving me? That's what he will say. This is the communication skill. Anyway, so I have shown you the history sheet, doctor, from this symptom. You will follow the history sheet in the down. What point important you will select by yourself. And your diagnosis is actually the peripheral arterial disease. Patient presented with intermittent claudication, vascular disease or arterial disease. So in this way, this type of checklist can help you, doctor. So it's very a chronic patient we have shown to you now. And And
Sir,
last
can
week,
I ask some question?
please, why not? We are at the end of the discussion almost.
Yeah, actually, I just joined just 5-10 minutes back.
Please.
Actually, the question is how we differentiate it with the with the claudication due to spinal stenosis.
Actually, our idea not to differentiating point discussion here, doctor, to show the checklist. Anyway, as you asked, intermittent claudication is ischemic pain, like ischemic heart disease. That you move, if you move, there will be pain in the cuff. If you take rest, it will be over. But in the any neurologic issue, suppose maybe spinal stenosis or disc prolapse, whatever you say, our job is to differentiate from the neurologic disease and from vascular disease. Not in the neurology, this is a spinal stenosis or the disc prolapse. It is again a matter of the specialist issue. Anyway, to differentiate the neurology, the nerve pain, already Dr. Taiba said that it is a type of radiating pain, moving pain. One. Second, the pain aggravates by different position of the body. It is a very simple clue. And this is enough for the point of general practitioners. Okay, doctor?
Okay, fine,
Thank
sir.
you.
Thank you.
So this type of symptoms, many symptoms, those who are very beginners from now onwards, because near the exam, if you want to prepare your checklist, it will not be time effective. The very first batch I can remember I dealt with before, they are near the end of their preparation, they were attached with us. And I advised them to create the checklist. Actually, they didn't have enough time to create. Only few doctors created their checklist. But from the beginners, those who appeared, especially in the last AKT, I hope that and pray that all of you pass the exam. From now, you know that your exam result will be published maybe after 1 month, around 1 month. So what you will do? If you have any personal life, social issue, any other issue, you'll be busy and finish it. But you have planned to appear OSCE earlier. You need to start your study from right now onwards. A little. Be connected. Suppose from our side, every day we don't have session now. Usually we arrange some free sessions like today. Maybe in future we will do some the breaking bad news station, some critical issues, some station of the angry patient management. Though we have recorded one in the YouTube, even then we will create some new cases for you. If you keep your eyes in our group, at that time, definitely you will come to know when we are going. You'll be busy. Minimum, you become a listener. Try to think, and the learning will be better if you go slowly, not very rapid. For that, you be connected with us, doctor, and we will try our best for you. And it's just for your understanding that is our pleasure. One doctor before, some of you know, she stood first, the Sudanese colleague. This is our pleasure to share with you. And now we are arranging, doctor, those who I don't know, any of appearing in the Chennai exam in the coming July. So this is our plan for this, the system-wise case practice for the July candidate especially. So those who are beginner, I don't like to invite them to be with these. We have the plan for the basic, the approach courses for the beginners, but not right now. You'll be busy, little piecemeal connection with different discussions. After your exam result is published, then you will come to know that what we are having for the very beginners. So with this word, doctor, I like to thank you. But even that few minutes, I can be with you if you have any special query, doctor, regarding today's discussion. Please, anyone? But one thing, let me do, doctor. Sorry, I am giving the what I say, our group, the WhatsApp and the Telegram group in the chat box. Those who couldn't connect with us, those are very new, especially for the OSCE. There are 2 links given. I will appreciate that if you feel free to join with us, to be attached with us, with our activities, and you will be updated with our activities there. And another one is the YouTube. If you don't have the YouTube ID, the link, so you can be with us, doctor, in the YouTube. I am giving in the next chat so that you can see and you can copy also in your software, the device. So this everything, doctor, from our side. Even then, I'm ready to respond, doctor, anything from your query. If you have all the slides shown to you. Feel free, doctor, a few seconds if you want. Anyone, please?
Would like to ask.
Dr. Taiba, please.
Yes, sir. What is the time given for each OSCE station?
10 minutes.
All right.
And before 2 minutes, you will have the warning. You have 2 minutes left.
Okay. Thank you, sir.
Okay, thank you very much. So I think we can finish now. Okay. And my gratitude to all of you, doctor, who joined with us to make a successful session today. And again, requesting, be connected, keep your eyes over the group. Maybe within 1 week, after coming few days, we will organize again one free session. I hope it will be again interesting for you. And try your best, doctor. Thank you very much.